Good afternoon, everyone. I am Kelly Waters, a health communication specialist in CDC's Center for Preparedness and Response, our Division of Emergency Operations. Thank you for joining us for today's EPIC webinar titled An Update on CDC's Response to E-Cigarette or Vaping Product Use Associated Lung Injury, EVALI. If you do not wish for your participation to be recorded, please exit at this time. You can earn continuing education by completing this webinar. Instructions on how to earn continuing education can be found on our website, emergency.cdc.gov/EPIC. The course access code is EPIC 1204 with all letters capitalized. To repeat, the course code to receive continuing education is, in all caps, EPIC1204. Today's webinar is interactive. To make a comment, click the chat button on your screen and then enter your thoughts. To ask a question, please use the Q&A button. The Q&A session will begin after our presenter has finished. Closed captions are available for this webinar. We're fortunate today to have Teresa Wang with us to discuss this public health emergency. Dr. Wang serves as a subject matter expert on tobacco product use surveillance among U.S. youth and adults. She's a lieutenant commander in the U.S. Public Health Service Commissioned Corps. She holds a PhD and master's in bioinformatics from Boston University and a bachelor's in biomedical engineering from the University of Michigan, Ann Arbor. Dr. Wang, please begin.
Thank you. Hi, everyone. Thank you for joining us today and for your interest in learning more about this emergency response. As you may be aware, CDC has been partnering with colleagues at the U.S. Food and Drug Administration, state and local health departments, and other public health and clinical stakeholders to investigate and gain a comprehensive understanding of a multi-state outbreak of e-cigarette or vaping product use-associated lung injury, also known as EVALI. Today, I'll share an overview of CDC's response efforts to EVALI, describe what we know, and discuss some key recommendations for healthcare providers, public health organizations, and the public. Next slide, please. Great. First off, this outbreak is occurring in the context of a dynamic marketplace for e-cigarettes or vaping products. So here's a very brief overview of these tobacco products. E-cigarettes or vaping products first entered the US marketplace around 2007. And as illustrated in this figure, e-cigarettes have rapidly diversified and come in many different shapes. You may hear them described as vapes, e-hookah, vape pens, tank systems, mods, or electronic nicotine delivery systems. Using an e-cigarette is commonly called vaping. And to describe it simply, e-cigarettes work by heating a liquid to produce an aerosol, which is then inhaled by the user. The e-liquid itself can contain a variety of substances and additives, including but not limited to nicotine, as well as tetrahydrocannabinol or cannabinoid oils, which are known as THC and CBD, respectively. And we'll get into some of that in the context of the lung injury response itself a little later. Next slide, please. As the nation's health protection agency, CDC's mission is to save lives and protect people from health threats. In responding to public health emergencies, CDC's first steps are to understand what is happening, establish where it's happening, and collect as rapidly as feasibly relevant data, as feasible relevant data to inform next steps. And with regard to EVALI, CDC has been working 24/7 to identify the root cause or causes of this outbreak. On August 1st, 2019, Wisconsin first alerted CDC to a cluster of pulmonary injury among young adults that began in July 2019. And since that date, CDC has been putting its scientific expertise to use across epidemiologic, laboratory, and clinical realms to address this public health crisis. On August 26th, CDC implemented an incident command structure. Then on September 16th, CDC activated its Emergency Operations Center, or EOC, to enable it to dedicate more resources to this investigation. And to date, approximately 300 staff from across the agency have been engaged in response efforts, including multiple staff who have been deployed to assist health departments in investigating these lung injuries. CDC's lung injury response efforts have been multifaceted, and in addition to being committed to identifying and defining the risk factors and causes of EVALI, CDC is also detecting and tracking cases of EVALI in the US. It's been establishing lab procedures that can assist with the public health investigation and patient care. And through the information collected and it's been committed to communicating actionable recommendations to state, local, and clinical audiences. Next slide, please. So what are some of the symptoms associated with EVALI? Based on data submitted to CDC, patients in this investigation have reported respiratory, gastrointestinal, and/or constitutional symptoms. Respiratory symptoms have included cough, shortness of breath, or chest pain. Gastrointestinal symptoms include nausea, vomiting, abdominal pain, or diarrhea. And constitutional symptoms have included fever, chills, or weight loss. Next slide, please. Some patients reported that their symptoms developed over a few days, while others reported symptoms developed over several weeks. In some patients, gastrointestinal symptoms preceded respiratory symptoms. Next slide. To date, this complex investigation spans almost all states and involves over 2,000 patients, as well as a wide variety of brands, substances, and e-cigarette or vaping products. Specifically, as of November 20th, 2,290 cases of EVALI have been reported to CDC from 49 states, the District of Columbia, and 2 US territories, including Puerto Rico and the US Virgin Islands. 47 deaths have been confirmed in 25 states and the District of Columbia. And based on established case definitions, all patients have reported a history of using e-cigarettes or vaping products. CDC also provides weekly updates on these numbers, and you can check for the latest data at cdc.gov/lung injury. Next slide. Here you can see the distribution of the cases geographically by US state and territory. Again, EVALI cases have been reported to CDC from 49 states, all except Alaska, and in 2 territories, with the highest counts in dark green in California, Texas, and Illinois. Next slide, please. This curve illustrates the dates of symptom onset in orange and hospital admission for patients with EVALI in blue. The most recent set of data points may suggest that the number of cases is declining. However, it's also important to take into account additional factors, such as reporting lag. This is a state-led investigation, and it can take time for states and providers to report their cases to CDC. Next slide. CDC recently updated the characteristics of EVALI cases. Among the 2016 cases of EVALI reported to CDC with available data on hospitalization status as of November 5th, 95% of patients were hospitalized and 5% were not hospitalized. 68% were male and 77% were under the age of 35 years, with a median of 24 years and an age range from 13 to 78 years. Next slide. So here's a more detailed breakdown by age group. 15% of patients were under the age of 18. 38% of patients were between the ages of 18 to 24. 24% of patients were between the ages of 25 to 34. And 23% of patients were 35 years or older. Next slide. CDC has also examined the information on substances used in e-cigarette or vaping products in the 3 months prior to symptom onset. So among EVALI patients with these information, 83% reported using THC-containing products, with 35% reporting exclusive use of THC-containing products. 61% reported using nicotine-containing products, with 13% reporting exclusive use of nicotine-containing products. 48% reported both THC and nicotine-containing product use, and 4% reported no THC or nicotine-containing product use. Additionally, available data suggests that non-hospitalized EVALI patients have similar demographic and e-cigarette or vaping product use characteristics as do hospitalized EVALI patients. Next slide. At this time, we know that most patients report a history of using THC-containing products, and that THC is present in most of the samples tested by FDA to date. Furthermore, the latest national and state findings suggest products containing THC, particularly those obtained off the street or from informal sources such as friends, family members, or in-person or online dealers, are linked to most of the cases and may play a major role in the outbreak. Next slide. For this response, CDC is aggregating data from its epidemiologic investigations with findings from laboratory testing of clinical and tobacco product samples in collaboration with FDA to really try and fit the puzzle pieces together and identify who is most at risk and the specific substances or ingredients causing these lung injuries. Specifically, as you see listed here, CDC is currently testing samples of fluid from the lung, which are also known as bronchoalveolar lavage or BAL samples, collected from the lungs of EVALI patients. And CDC is also offering testing of state's pathologic specimens, including lung biopsy or autopsy specimens associated with the patients. Additionally, CDC is offering aerosol emission testing of case-associated product samples from e-cigarette or vaping products and e-liquids. Analysis of aerosol emissions is intended to augment the FDA's ongoing work to characterize e-liquids and to improve our understanding of exposure among case patients associated with the lung injury outbreak. And together, these results can provide insight to what entered the lung of patients with these lung injuries and give us additional information about the nature of the chemical exposures contributing to this outbreak. Next slide. So speaking of laboratory testing, CDC announced a breakthrough finding a little over 2 weeks ago on November 15th. That vitamin E acetate was found in all 29 BAL samples tested among patients from 10 states. This convenient sample represents specimens collected in the course of clinical care from patients with EVALI. Although vitamin E acetate was detected in all samples, additional studies are needed to establish whether a causal link exists between this exposure and EVALI. Of note, CDC also tested for a range of other chemicals that might be found in e-cigarette or vaping products, including plant oils, petroleum distillates like mineral oil, MCT oil, and terpenes, which are compounds found in or added to THC products. None of these other potential chemicals of concern were detected in those BAL fluid samples tested. These findings provide direct evidence of vitamin E acetate at the primary site of injury within the lungs. This is the first time a potential chemical of concern has been detected in biologic samples from patients with EVALI, but again, more research is needed to establish whether this apparent association is causal. Next slide. Here are some key facts about vitamin E acetate. Vitamin E acetate is an oily substance and might be used as an additive, most notably as a thickening agent or diluent in THC-containing e-cigarette or vaping products. It's found in many foods, including vegetable oils, meats, fruits, and vegetables. It's also available as a dietary supplement found in many cosmetic products. It's generally regarded as safe when ingested as a supplement or applied topically to the skin. However, previous basic science research suggests that inhaled vitamin E acetate might interfere with normal lung functioning by disrupting lung surfactant, or this fluid secreted by the tiny air sacs in the lungs. Next slide. So it's important to note that while it appears vitamin E acetate is associated with EVALI, evidence is not yet sufficient to rule out contributions of other chemicals of concern to EVALI. Many different substances and product sources are still under investigation, and it may be that there is more than one cause of this outbreak. However, these findings help us to better understand the potential compounds or ingredients that may contribute to the cause or causes of EVALI. Next slide. As this investigation continues, CDC is dedicated to providing evidence-based recommendations as guidance. These are a few of CDC's recommendations for healthcare providers. CDC encourages clinicians to report possible cases of EVALI to their state or local health departments for further investigation. And the most critical step in assessing EVALI is to ask patients about recent use of e-cigarette or vaping products. If confirmed, the types of substances used, such as THC and nicotine, and where they were obtained should be noted. Next slide. EVALI is a diagnosis of exclusion, since at present no specific test or marker exists for its diagnosis in a patient. Healthcare providers are recommended to consider all possible causes of illness in patients reporting respiratory and gastrointestinal symptoms. They should evaluate and treat for other possible causes of illness as clinically indicated, and consider consultation with specialists, such as those in pulmonology, infectious disease, critical care medicine, medical toxicology, psychology, psychiatry, and addiction medicine as appropriate. For patients who report use of e-cigarette or vaping products, evaluations should include assessment of vital signs and pulse oximetry. Patients with suspected EVALI should be admitted to the hospital if they have decreased oxygen saturation while breathing room air or are in respiratory distress. Next slide. An algorithm for patient management is available to clinicians and can also be found on CDC's lung injury website. In terms of post-discharge follow-up, patients discharged from the hospital after inpatient treatment for EVALI should ensure follow-up no later than 1 to 2 weeks after discharge. Not all patients with signs and symptoms concerning for EVALI need to be hospitalized. Some patients with recent history of e-cigarette or vaping product use who are evaluated for respiratory, gastrointestinal, or constitutional symptoms might be candidates for outpatient management. And EVALI symptoms can progress rapidly, so follow-up within 24 to 48 hours is an important part of outpatient management. Additional follow-up might be indicated based on clinical findings. And patients should be advised to return immediately if they develop new or worsening respiratory symptoms. That being said, hospital admission should be strongly considered for patients with concurrent illness such as influenza and potential EVALI, especially if respiratory distress, comorbidities that compromise pulmonary reserve, or decreased oxygen saturation are present. And given flu season considerations, healthcare providers should emphasize the importance of routine influenza vaccination for all persons aged 6 months or older, including patients who use e-cigarette or vaping products. Next slide. Advising patients to discontinue the use of e-cigarette or vaping products should be integral to the care approach. Healthcare providers should offer or connect services to stop using e-cigarette or vaping products, and resuming use of these products has the potential to cause slowed recovery or recurrence of symptoms or further lung injury. So patients should be provided with evidence-based interventions, including behavioral counseling and FDA-approved cessation medications. Adults and adolescents and young adults might benefit from specialized services such as addiction treatment services and providers who have experience with counseling and behavioral health follow-up. Persons with ongoing marijuana use that causes significant impairment or distress might have a cannabis use disorder, and persons with cannabis use disorder should receive evidence-based interventions, and consultation with addiction medicine services should be considered. Next slide. CDC wants its partners to quickly share what they know about possible cases of EVALI. Healthcare professionals are advised to report cases of lung injury of unclear etiology and a history of e-cigarette or vaping product use within the past 3 months to state, tribal, local, or territorial health departments. Public health officials should promptly notify CDC about possible cases of lung injury associated with the use of e-cigarette or vaping products via EOC Event 101 at cdc.gov. And state, tribal, local, or territorial health departments that need collection tools, reporting guidelines, case investigation forms, and technical assistance can also contact CDC at that address. Next slide. Of note, states have been asked to only report hospitalized EVALI cases to CDC starting last Tuesday, November 26th. Further collection of data on non-hospitalized cases will be at the discretion of individual, state, tribal, local, and territorial health departments. CDC stopped the collection of data on non-hospitalized cases of EVALI for several reasons. First, patients with EVALI may have similar symptoms to flu or other respiratory illness, and it might be difficult to distinguish EVALI from other respiratory illnesses. And second, the finding and reporting of non-hospitalized patients could become more difficult and burdensome given the potential for large numbers of respiratory illness during the emerging flu season, and may be of limited value to the ongoing investigation. Moreover, recent information regarding the characteristics of hospitalized and non-hospitalized EVALI patients were released in a CDC report published in MMWR on November 22nd. Next slide. In terms of recommendations for the public, CDC recommends that people should not use e-cigarette or vaping products that contain THC, particularly from informal sources like friends or family, or in-person or online dealers. Until the relationship of vitamin E acetate and lung health is better understood, vitamin E acetate should not be added to e-cigarettes or vaping products. In addition, people should not modify or add any substance to e-cigarette or vaping products that are not intended by the manufacturer. This also applies to products purchased through retail establishments. Next slide. I mentioned this previously on one of the other slides, but another key message CDC is reiterating to the public is that these findings still do not rule out other possible compounds or ingredients that may be contributing to these lung injury. So more information is needed to link patterns of use of e-cigarette or vaping products with one or more products, substances, and brands responsible for the lung injury. Thus, the only way to assure that you are not at risk while the investigation continues is to consider refraining from the use of all e-cigarette or vaping products. Next slide. CDC is also recommending to the public that if you continue to use an e-cigarette or vaping product and you have symptoms of lung injury, see a healthcare provider and report your e-cigarette or vaping product use. Importantly, adults using e-cigarettes to quit smoking combustible cigarettes should not go back to smoking. They should weigh all risks and benefits and consider utilizing FDA-approved medications. And irrespective of the ongoing investigation, CDC has consistently reinforced that there are certain populations that should not be using e-cigarette or vaping products. Specifically, e-cigarettes should never be used by youth, young adults, or pregnant women. There is no safe tobacco product, and all tobacco products, including e-cigarettes, carry a risk. Adults who do not currently use tobacco products should not start using e-cigarette or vaping products. Next slide. For adults who have ongoing problematic marijuana use leading to impairment and distress, effective treatments are available and recovery is possible for people who have this disorder. A number of therapy-based treatments such as cognitive behavioral therapy, contingency management, motivational enhancement therapy, and multidimensional family therapy have been shown to help people who are addicted to marijuana. And here we've linked the Substance Abuse and Mental Health Services Administration's treatment locator and the number 1-800-662-HELP. Next slide. In terms of outreach, CDC ensures that the findings from this investigation are provided in a timely manner and communicates regularly with consumers, clinicians, and public health professionals through a combination of traditional media, social media, and other channels. So here are some ways to stay connected through Twitter, Facebook, LinkedIn, and Instagram. Next slide, please. This is a very dynamic investigation, and CDC is in close communication with states and FDA to ensure that they're providing tools and resources that facilitate streamlined data collection as well as data linkage to help continue to identify the cause or causes of these lung injuries and to provide recommendations for state health departments, clinicians, and the public. For instance, in collaboration with the FDA, CDC convenes a weekly national call with state and local public health partners, during which hundreds of participants can hear updates from the response and pose questions. And additionally, as you see here, FDA and CDC have jointly developed resources that outline the process by which states can submit case-associated product samples to FDA and CDC for testing. And detailed information for product testing can be found on the Lung Injury Response website and through these respective email addresses. Next slide. In terms of scientific publications, here on your left is a snapshot of some CDC-led or co-authored reports published since the beginning of the response. And most of these have been disseminated through CDC's Morbidity and Mortality Weekly Report, or MMWR. If you're unaware, this is CDC's primary vehicle for scientific publication of really timely and useful public health information and recommendations. And together, these have played a key role in helping reinforce key public health recommendations to Preventive Valley based on the epidemiologic, laboratory, and clinical data being analyzed by CDC. Next slide. So before I conclude, I wanted to reiterate that CDC is maintaining a lung injury outbreak webpage with key messages and weekly updates on case counts, deaths, and related resources. You can find it by navigating to cdc.gov/lung injury. And if you have questions about CDC's investigation, you can also contact CDC Info through their online email form or by dialing 1-800-232-4636. Thanks for listening in, and I think we can open it up to discussion and questions.
We will do that in just a second. Thank you, Dr. Wang. We are going to transition to our Q&A session. First, I want to welcome your colleague, Brian King. He is CDC's senior official for the lung injury response, and he has also joined us by telephone to help answer questions. Jonathan, can you read the first question?
I can. I'm going to read a question from Lisa Johnson. It's a clarification question before we start out. She was just asking for clarification. Do you want individual providers to report suspected Ebola cases
Sorry, folks. I think we're waiting for Jonathan to get reconnected to audio. So please bear with us for 1 second. I think he cut out for a second there, but he's gonna pull up the question as soon as he's ready. So thanks again. Please stand by.
Apologies, everyone. My audio just spontaneously died, so a little awkward, but I apologize for that. Our first question is one just for clarification. It is from Lisa Johnson. She's asking, do you want individual providers to report suspected EVALI cases, or do you request that only hospitalized cases be reported by health departments?
Thanks for your question. I'll just speak briefly back to what I alluded to in the presentation, but then I'll also, if Brian King wants to chime in as well. We did release a statement saying that states have been asked to report hospitalized EVALI cases to CDC starting last Tuesday on November 26th, and that the further collection of data on non-hospitalized cases will be at the discretion of individual state, tribal, local, and territorial health departments. Brian, do you have anything else to add for that?
No, that's absolutely correct. These are ultimately state-led investigations, and we defer to the states to make the decisions about what data is best to inform their respective investigations. And in terms of CDC's role, given that we know 95% of the patient cases are indeed hospitalized, and there wasn't marked variability in terms of the characteristics of those patients, we're only requesting the hospitalized patient data. But we certainly continue to reinforce the importance of clinician reporting. And so we'd encourage you all to continue to do that reporting to your respective state health departments based on their individual directives.
Thank you, Brian.
Okay, our next question is from Charla Haley, who asks, any idea whether the EVALI patients have completely recovered or if they are still having respiratory issues?
I'll defer to Brian on that if he knows anything about in terms of the recovery of these patients.
Yeah, so we ultimately do know that there's a lot of variability depending upon the individual patient. We do know that there's also severity in the disease, but as we noted earlier, the vast majority are indeed being hospitalized, some to the point of intubation and being admitted to the intensive care unit. In terms of recovery, it does vary by a variety of factors, but what we are concerned about is that we have seen some instances of recurrence, particularly among individuals who have gone back to using e-cigarette or vaping products. And so we've ultimately reinforced the importance of, particularly among those for which symptoms have been alleviated, particularly through corticosteroids and some other recommendations that are clearly outlined in our clinical guidance, that those individuals do not return to using the products. But in general, there's variability in terms of the long-term onset of injury, but we do know that there's certain factors, particularly corticosteroids, that have alleviated symptoms.
Okay, thank you. The next question comes from R.C. Showers, who asks, since vitamin E has become a suspect culprit, what does that have to do with the connection to THC-based products? What is the connection between vitamin E and THC?
So again, really quickly, I think it'd be helpful to, one of the slides that I presented was based on the data where we CDC examined information on substances used in e-cigarette or vaping products in the 3 months prior to symptom onset. And again, I believe those numbers were that among EVALI patients with those complete data, 83% reported using THC products, so the majority, with 35% reporting exclusive use of THC containing products. products, as well as still there being 61% reporting using nicotine-containing products, with 13% reporting exclusive use of nicotine-containing products. But among, in terms of those BAL findings for positive, for all of them tested positive for vitamin E acetate, and we know that vitamin E acetate can be used as a diluent for THC-containing products. But again, this is not the only substance that is currently undergoing investigation. There may be more than one cause related to this. But Brian, do you have anything else to add with regard to the THC component of these findings?
Yeah, sure. And so I think that Teresa hit the nail on the head in terms of the response. It's important to note that, these products can be used to deliver a variety of substances. And typically with nicotine-containing products, you don't necessarily have the same types of substance or the need for a diluent, which is basically what we're seeing with the THC-containing products. And particularly for the illicit market, we're seeing that people are cutting the product, the liquid, with certain diluents. And that can include vitamin E acetate or a variety of other things. But basically that allows you to get higher volume for a lower cost. And so it would make sense in terms of, informal sources and illicit sale that this type of substance could potentially be added to the products. And so it's very much, something that's squarely focused with the use of THC-containing products, although I'll reinforce that it could also be used for other types of substances, including CBD as well. But at present, vitamin E acetate is primarily a cutting agent used for THC-containing products, and we continue to investigate other potential causes as well, but that certainly emerged as a chemical concern in the current investigation.
Thank you. The next question comes from Eric Lindemann. It's probably a good follow-up question to that one. Are there any indications that the products on the informal market still contain vitamin E acetate, or have producers responded by stopping the practice of adding this diluent?
Brian.
Yeah, so, it's hard to say because, we're still in the throngs of an outbreak investigation. What I can say is there's been a lot of dialogue around vitamin E acetate since CDC, the FDA, and others have reinforced this as a potential chemical concern, and we found in the bronchoalveolar lavage samples of the limited number of patients for which we presently have data. There's a variety of other communities and states that have implemented policies specifically aimed at prohibiting the inclusion of this particular diluent in these products. But at present, it's too premature for us to know what that ultimate impact of those efforts will be. At the present point, we're in the middle of an ongoing multi-state investigation, and so our number one priority is warning the American public about risk based on the best available data that we have. And right now, we certainly know that most of the cases are using THC-containing products, and that vitamin E acetate is a cause for concern. But I can't reinforce enough that there's a variety of different substances that can be put into these devices to serve in the same capacity as vitamin E acetate is being used in terms of a diluent to cut these products. And although some of these things may be safe to put on the skin or to otherwise ingest, that doesn't necessarily mean that they're safe to inhale. And so it's really important that we remain vigilant around continuing to investigate potential causes. But at present, there's a lot of efforts to broach that vitamin E acetate directly, but we just don't have the data yet to know long-term impact of what those efforts will be. But in the meantime, we're definitely warning people using the best available data we've got.
Thank you. The next question comes from Aubrey Adams. Is vaping THC and CBD at a higher temperature a factor? And just to expand that question, if it's those chemicals or anything else, does a higher temperature make it more risky?
I think that's a good question. I'm not aware of the science that's out there, but I do know that there are ongoing studies trying to tease this out a bit further. So I would imagine that the jury's still out in terms of the exact clinical effects, depending on the nuances of how temperature and all these other factors, what they mean in terms of implications physiologically, as opposed to, for instance, in a basic lab research setting. So those are things that I believe many people are interested in looking at and continuing to do so as this investigation evolves and we continue to just disseminate more information.
A question related to reporting. Is it possible that the spike in reported cases is due to a lack of consistent reporting before the first reported death in Wisconsin? And in general, can you comment on the possibility there may have been some inconsistent reporting at either end?
So I'll just speak to that briefly, and then maybe Brian can chime in. But I think certainly, as with any response, when you're trying to rapidly coordinate across multiple states and standardize definitions as well as the tools, that this may in fact be a factor in terms of when you're looking at that epi curve and the dates of symptom onset and being able to track these cases. And now that we're more so in a steady state in terms of being able to get that information out there in a consistent manner, I think we're able to get a better sense of what's happening real time, but certainly I do think that may be a factor. So I don't know if Brian has anything else to add with that.
Yeah. I mean, the only thing I'd add is that as part of CDC's role on this investigation, we have a cadre of world-class epidemiologists that are using a variety of different surveillance tools to really answer a lot of key questions related to this investigation. And one of them is the one that you pose, is this a new phenomenon, or is it something that had been occurring at levels, undetected for a while? And so in addition to the self-reported surveys that we've been using with data from the states, which Teresa mentioned in terms of collecting information on substances used in products, we also use something called syndromic surveillance. And basically, this allows us to look historically back at hospitalizations for severe lung injuries that mirror EVALI and that are also associated with the use of e-cigarette or vaping products. And by using that syndromic surveillance of hospitalizations and ED visits, it shows us that we've always had an underlying level of hospitalizations and reports of signs and symptoms similar to EVALI related to e-cigarette or vaping products for a couple years, but something new definitely happened this summer, particularly around June and July. And so we're continuing to investigate those data. The spike could be because of in part because of the increased attention by the media, and that clinicians and even the general public were likely more diligent in reporting these things. But it's quite apparent to us that something new definitely happened within the past few months. But on balance, it's also important to note that we've always seen an underlying level of these types of signs and symptoms, albeit at a markedly lower level than we've seen within recent months. And so that could be the result of multiple factors, including lower levels of use of the potential problematic agent, or it could also be the use of other types of e-cigarette or vaping products. We know that the e-cigarette landscape in particular has evolved over time, including nicotine-containing products, including those that deliver nicotine salts, which could contain a higher hit in use to an individual and also have potential higher risk of respiratory issues, particularly for the young people that are primarily affected by this outbreak. So the jury's still out in terms of all the different factors, but we still have not ruled out the fact that there could potentially be multiple causes of this outbreak investigation. We certainly know THC is at the forefront, and it's certainly something new that's happened within the past couple months. But there could be a multi-factor etiology here, and we need more data to investigate that. And the other important question that we can answer from that syndromic surveillance as well is, are things starting to attenuate in more recent weeks? We've always had a reporting lag from cases, but that syndromic data will also help inform whether we're making progress in terms of reducing case counts. So CDC is committed to releasing these data as soon as they're able, and I can assure you that we're in the process of writing those data up and getting them out to the public as soon as possible to answer these really key questions that up until now we just didn't have the data to answer, but now we're getting to the point where we are, and as we've noted several times, CDC is a data-driven agency, and we use the data to inform our recommendations. That's what we've always done, and that's what we'll continue to do for this investigation as well.
Thank you so much. The next question comes from Ryan, who asks, do we have information regarding the mechanism of toxicity of vitamin E acetate?
Thanks for your question. I think in terms of the mechanism of toxicity, as I had mentioned, there's been a combination of basic science research as well as things that are trying to mirror more closely what is going on physiologically speaking in the lungs. And I think given this particular investigation and what we're finding, I think we're still getting in the process of getting a confluence of information there before we can really pin down a specific mechanism. I think there are theories and hypotheses about things to follow up on in terms of what exactly is happening at the interplay of where the vitamin E acetate is what it exactly it's doing to the lungs. And I had mentioned that there's been some basic science research published disclosing how it may be disrupting the normal lung function of lung surfactant within the lungs. But as far as other types of specific mechanisms, I think that's still being followed up on.
Thank you. We have gotten multiple questions asking if vitamin E acetate is present in the official licensed products as well. Do we know the answer to that question?
Brian, have you heard anything about that?
Yeah, so it's too premature to say that exactly. We continue to get information from self-reports from a variety of different channels in a variety of different states. And at present, we do have self-reports of individuals obtaining THC-containing products from both informal as well as some formal sources, including licensed dispensaries. But it's also important to note that in some cases, these people have obtained products from a variety of different sources. And we ultimately, need more data on this. So we're currently working with a variety of different states, particularly those with both, legalized recreational medicinal cannabis use as well as those without, to really get the data out to inform the types of discussions around answering that specific question. But right now, CDC's recommendations is very broad in terms of, we definitely recommend that people do not use THC containing products, but particularly those from informal sources. But you'll note that it's not just informal sources. Until we have the data to definitively say that those formal sources haven't potentially been, a contributor to the outbreak, we're not prepared to diminish that current recommendation, which right now is very much to not use any THC-containing e-cigarette or vaping product.
We got one comment asking about poison control centers. And I was wondering if you guys could comment on how either healthcare providers or public health officials should work with poison control centers, or if there is some appropriate source of information for poison control centers specifically.
I'm not personally sure of the exact protocol that poison control centers are, or the exact role that they're currently playing. But again, I think this is something where healthcare providers can work closely with their local community health departments. And also we have a page dedicated to information for healthcare providers on the cdc.gov/lung injury site, in which case I believe that there are several resources there that may be able to answer your question a little bit more fully in terms of how the role that they're playing. But we do know that traditionally poison control centers have also played a key role in terms of e-cigarettes more broadly, where people may have reported nicotine poisonings and whatnot. And so I do agree that this would be something to be cognizant of, but unless Brian has other thoughts about the poison control centers specifically, I would also just advise them to visit the lung injury website.
Yeah, absolutely. And I echo, Teresa there, cdc.gov/lung injury. We do recommend in our information to the general public that if you're concerned about your health after using an e-cigarette or vaping product, that you contact your healthcare provider or a local poison control center at 1-800-222-1222. And so we're ultimately working very closely with the poison control centers. And as Teresa has noted, they've been instrumental in monitoring calls related to e-cigarette or vaping products for many years, but particularly particularly in this outbreak, we are directing the public to those resources for immediate concerns about health. But it's also critical that these entities work, that people with suspected EVALI contact a healthcare professional as well.
Thank you. We've gotten multiple questions about comparing the outbreak, the occurrence of cases in the US to global data. Can you comment more on what we know and what comparisons there are? Because of course, CDC is focused primarily on the United States, so we wouldn't know as much as some other organizations might.
I'll let Brian take that one.
Yeah, so good question. I can assure you that CDC is working very closely with our international counterparts, including at the World Health Organization, as well as individual country governments. At present, it does not appear that any country has near the situation that we're facing currently in the United States. The closest is Canada, which has reported some cases of EVALI, but again, at significantly lower magnitude than what we're seeing in the United States. Otherwise, there have been sporadic cases reported internationally, but again, I'll reinforce that we continue to believe that EVALI likely has multiple causes. And so the ultimate root of the mass spike that we've seen in the United States could very well be different from some of the cases that we're necessarily seeing internationally. In terms of the geographic variation that we're seeing, I think it's quite interesting that the only place where we're seeing cases at even a slightly elevated level are in Canada. And if you look at some of the domestic information as well, it's these geographic outliers that haven't yet been impacted by the outbreak, including Alaska and Puerto Rico was only recently added to cases. And so what this really reinforces is some unique geographic precision around where this outbreak has occurred. And that's something that we continue to investigate here at CDC through a variety of avenues, but one potential etiology could indeed point towards supply chain around particularly illicit products and how those have been distributed or used across the United States. But in terms of international cases, we are carefully monitoring it with a variety of partners, but at present there's no country that has anywhere near the magnitude of cases that we're seeing in the United States.
Thank you, Brian. And to follow up on some of the previous questions about legitimate distributors and vitamin E acetate, because we have had some industry people log on and comment as well, and that's kind of not our focus and not something that we would get into. But can you comment on the mechanism of communication about this concern to the legitimate industry? Because I do understand there is some communication going on.
So I'll just really quickly say that CDC has been partnering and working very closely with the FDA as well. And CDC itself is not a regulatory agency, but that FDA has also been closely following up on the manufacturing distributing side of this investigation. But in terms of any late breaking information, I don't know if Brian has anything to add with regard to that.
Yeah, nothing further, and I'll just reinforce what Teresa said, that, CDC's angle on this is really we're a public health agency, and we work 24/7 to protect people's health. And there's different agencies that have complementary yet distinct roles on this investigation, and we ultimately defer to the enforcement agencies to address that, and that includes FDA, DEA, and also our respective state agencies. But in terms of CDC's role, we're primarily responsible for ensuring that we continue to coordinate with states and collect the data to inform evidence-based recommendations that are made to protect the American public's health.
Okay, and it looks like we're running near the end of time here, and we've gone through most of the questions that are focused on the topic of this webinar. I will mention that we have somebody in the Q&A section who's Gail Thompson, who's commented that there is just now been reported a first case in Alaska. So as you can see, with all outbreaks, it's a constantly updating event, and so we report the latest information as we can. But that's it for our related questions. So I'm going to punt it back to you, Kelly.
Thank you again, Teresa and Brian and Jonathan. Thank you to everyone who's joined us for today's webinar. If you do have additional questions, if you had a question that didn't get answered, you can email them to EPIC, epic@cdc.gov. And as a reminder, today's presentation has been recorded. You can earn continuing education for your participation. Please follow the instructions found on emergency.cdc.gov/EPIC. The course access code is EPIC1204 with all letters capitalized. Thank you again, everyone. Goodbye.